Hello and welcome. I'm Bill Latimer, the founding dean of the School of Health Sciences, Human Services and Nursing at Lehman College, the City University of New York. The CUNY Institute for Health Equity recently hosted its first conference entitled Equity Now. The conference included a keynote speaker, Dr. Tom Leviste from George Washington University, 2 expert panels, and a student research poster presentation. What you're about to see is the second of 2 panels that focused on workforce development. I hope you enjoy it. How was the poster session? Was it good? Good. I'm so glad. This is a good crowd. I'm glad that you stayed. So the focus of this second panel is on workforce development and essentially job skills, professional development in health professions broadly defined. We're extremely fortunate to have with us Dr. Lynn Holden, President of Mentoring in Medicine, Milton Nunez, Chief Executive Officer at Lincoln Hospital, Dr. Viviana Abreu Hernandez, Director of Research and Development of Programs, Training and Upgrading Fund of the 1199 Training and Employment Fund, and Jeff Menkes, President and CEO of Burke Rehabilitation Hospital. With that said, I will turn it over to my esteemed colleague, Dr. Georges.
Good afternoon. I echo Dr. Latimer's thoughts and say I'm glad you stayed and you're in for a great treat this afternoon. I'm pleased to be able to introduce someone who I have the highest respect for. I think she's simply fabulous. She could be my daughter, that's why. Is Dr. Lynn Holden, who's president of Mentoring in Medicine. And for any of you or your families who may have entered the emergency room at Montefiore, you may have seen this person walking around in scrubs and a white lab coat. She's a board-certified emergency medicine physician who's practiced at Montefiore Medical Center here in the Bronx for more than 20 years, and she doesn't look a day older than when she finished med school. She's also an associate professor of clinical emergency medicine at Albert Einstein Hospital here in School of Medicine here in the Bronx. The most important thing you need to remember for today and where she will be talking to you is back in 2006, she co-founded what's now known throughout this nation as one of the premier programs for assisting those interested in health professions, medicine, OT, etc. And the mission of that group is to increase the diversity of the science and healthcare workforce by providing academic enrichment, leadership development, civic engagement, and mentoring to those students who come from socioeconomically disadvantaged backgrounds, but they're really interested in a biomedical career. Her program has served over 50,000 students to date and have recruited nearly 1,000 health and science professionals nationally. And Lehman College has been the place where she has been doing those trainings right here on our campus. So we're happy to welcome her.
Thank you.
Dr. Holden, I gave a very brief intro because your CV is quite full. But could you give us a sense of the Mentoring in Medicine program and what are some of the outcomes that you look for in that program?
Absolutely. First of all, it's a pleasure to be here. Thank you for the invitation. And I think it's important that we realize that there are certain obstacles, perceived obstacles and real obstacles that disadvantaged students face when it comes to pursuing their dream of becoming a healthcare professional. And so we have found that from the student's perspective, that lack of confidence is really the #1 reason why students are reluctant or afraid to pursue a health career. In addition, there's a lack of resources and a lack of financial means. So we really try to meet students where they are. We meet them, we start in 3rd grade elementary school and we go all the way up through health professional school. And not so much as a primary program, but as a program where we introduce students to programs like this or other summer internships, etc. So what's been interesting is that we have now merged our elementary, middle, high school programs, in-school programs, and our college and health programs. So it's great to see some of our high school graduates in college going back to their high schools and teaching our curriculum in the after-school programs. To date, we've had approximately we have about a 92% acceptance rate to medical school, and we have more and more students not only going into medical school, we have about 400 who have gone through medical school or in residencies, which is significant because all of them were told no, either academically or by their family, etc. So now we have more students going into not only PA school, but also into public health school and into nursing. So we're very excited to be able to expose students to all of these careers and to help them to realize their dream.
Lynn, that's excellent. I actually ran a couple of training programs at my prior institutions, and that had a lot of minority representation, and a lot of what you're saying brings back so many positive memories for me during that time because it was just such great fun on many levels. So we're going to go down the line the way we did last time, and then we'll start an open discussion. Milton Nunez was actually one of our leadership awardees at this past Leadership Award Gala that Lehman puts on for his absolutely fabulous work that he's doing at Lincoln Hospital here in the Bronx. Again, for those of you that know that region of the Bronx or Lincoln Hospital, they're definitely serving vulnerable populations, so it's critically important that they're there. During my opening remarks, I made the point that Lincoln is one of the very, very few baby-friendly designated hospitals. Their women's health center, and I've seen it, is absolutely fantastic. They've got an incredible staff. And again, they're working with moms to promote breastfeeding when their infants are born, because it's been known for a long time that breastfeeding has a lot of both interpersonal and biologic things that really help the baby and the mother. They also have a state-of-the-art emergency department, trauma center.
That's right.
And again, a lot of that really is due to Milton's exceptional leadership. He has over 25 years of experience in healthcare with a strong background in finance and information technology. Under his leadership during the last 4 years as CEO of Lincoln Medical and Mental Health Center in the South Bronx, many changes have been implemented, including some that I've just listed. What I didn't know until I read this was that you have taken graduate coursework at CUNY Graduate Center.
Yeah.
Is that correct?
Yeah, that's
right.
correct.
So that you're actually one of ours.
That's right.
We could take credit for you. Anyway, I'm really thrilled to have Milton here. You're the CEO of a major hospital, a major public hospital in a borough and a city that has enormous strength, incredible residents, so much to celebrate, and yet enormous health disparities and a lot of very significant health problems. We've had this conversation at least several times, but what are the health professionals you most need? What are the gaps at a Lincoln hospital that you need filled in order to accomplish your mission better? So that if I'm in the audience and I'm thinking about a wide range of careers, what are some of the things you're looking for?
Sure. So, first of all, thank you for inviting me this afternoon. And I always love coming to the campus. I wish we could trade places. I like being a college student. So at Lincoln, we're always looking for a number of different professions: nurses, PAs, NPs, physicians. There's always a need for really great talent. Our current shortage right now is nurses. I have 3 PA vacancies. I have 2 NP vacancies. I have 3 physical therapist vacancies. I think I have a speech therapist vacancy.
See, aren't you glad you came?
Right. I have a trauma surgeon vacancy as well. I have a neonatologist vacancy. So I have a lot of vacancies, but we're also looking for particular skills. And I want to highlight two skills, or two, maybe one's a skill and one is a characteristic of what we look for everyone who works at Lincoln and everyone who wants to work at Lincoln. The first one, and it's because healthcare is going through a lot of changes, so I can't sit here and tell you what it's going to look like 5 years from now or 10 years from now. Anyone who tells you that really doesn't, it's a crystal ball that's really cloudy. But the first skill is critical thinking. And whether you're a nurse or a physician assistant or a primary care physician or a trauma surgeon, we need folks that are really good at critical thinking. And because that leads to problem solving, that leads to better outcomes at Lincoln, and that frankly, in a very selfish way, that leads to fewer headaches for me. So really strong critical thinkers. The second piece that's incredibly important is we need folks that have empathy. Empathy is incredibly important. Now, I'm a numbers guy, and so early on in my career, I kind of poo-pooed that. It's like, that touchy-feely stuff. But empathy is incredibly important to patients. So you could be a really good nurse, you could be a really good primary care physician or a really good PA. If you are not someone who can express empathy easily, healthcare is not going to be the field for you. I can tell you that straight out. Okay? So we need nurses, we need PAs, we need NPs. Bilingual, please. But please make sure you come with your critical thinking suitcase, and please make sure you come with your empathy suitcase. Okay? Thank you.
Our next panelist is Dr. Viviana Abreu Hernandez. I met her in Puerto Rico, God, how many years ago, who is now the Director of Research and Development of Programs, Training, and Upgrading Fund of one of my greatest supporters and resources, 1199 SEIU Training and Employment Funds. We've had a long relationship, the Department of Nursing, with the Upgrade and Training Fund. And one of the things that she's done in this position is in collaboration with higher education institutions such as ours, she's developed programs of study that address directly the needs of the healthcare industry in New York City, and particularly here in the Bronx. Prior to coming here, Dr. Abreu Hernandez served as Puerto Rico's Commissioner of Higher Education. And she did a great and fabulous job there, and she developed and implemented higher education policies that still have an impact regardless of the financial situation in Puerto Rico. I know you read the news, right? That's impacting both public and private sectors of post-secondary education. Dr. Abreu Hernandez, if you would talk to us particularly about 1199's large program that you have here in the Bronx Learning Collaborative, with, I think our students and faculty would be interested in hearing about that.
Yes, thank you. Thank you, Dr. Latimer, for inviting me. A little bit over 5 years ago, I was invited to come to New York and develop programs to address the healthcare workforce need, particularly diversity in the Bronx. And for some reason, they thought I was an expert on Latino higher education. What they didn't realize is that everybody in Puerto Rico was Latino, so I didn't have a particular expertise, but they gave me the job. So 1199 represents about 200,000 workers in New York City. And 78% are women, 47% are immigrants, and 68% are people of color. So this is the population that the union represents. Yet, the healthcare outcomes of the population that actually is the union body has the worst healthcare outcomes in the city and the Bronx. So the union negotiates in the collective bargaining agreement a benefit that is for education and training. So we provide the training fund, support to incumbent workers, so the incumbent workers can move from frontline healthcare jobs all the way if they even want to go to a PhD program or MD program. So these are, we manage about $36 million a year, which is not enough. Now, the union workers are all over the city, but the health crisis, the disparities, the healthcare outcomes are the worst in the Bronx. If you were here this morning, you heard the crisis of 62 out of 62. So one thing that I learned from my boss, Sandy Vito, is that we cannot educate you out of poverty. So what that means is that a college degree doesn't guarantee you a job. Over 50% of the professors with PhDs in higher education in the country are adjunct professors. So you can reach the highest level of education in your discipline and still have a poverty salary without benefits. So on the one hand, we want to provide education benefits to incumbent healthcare workers, and at the same time, we need to put them in career pathways that will move them from a lower level job to an upper level job with a higher salary and with benefits. So union jobs are important. The union represents all job titles with the exception of physicians. So I will talk to you if I have the opportunity about what to do regarding how to place yourself in a career ladder. But in the Bronx, what we have done is to articulate the needs of the healthcare industry with the ability to provide tuition assistance to incumbent healthcare workers and convince the higher education institutions in the Bronx that they have to address the needs of inequality in access to higher education. And that's the population that we serve.
Beautiful.
That's great. Thank you so much. Jeff Menkes is also an honoree of Lehman College, and that will be celebrated at this year's commencement. He recently, and a graduate of Lehman College. Am I allowed to say?
Yes, please do.
1973. Did I get it right?
Well, close enough.
Close? I'm a graduate from 1923. We're thrilled to have him here. He came to Lehman about 3 weeks ago, met with students, met with faculty. He has an enormous, like everyone on this panel, has an incredible knowledge base in relation to healthcare by virtue of his experience, which includes 30 years of leadership and healthcare experience at Montefiore Medical Center. Over the course of his career, he's held a number of positions in New York-based academic medical centers. He was recently appointed the president and CEO of Burke Rehabilitation Hospital in White Plains, New York, which we hope to definitely build some new bridges with. He's an expert in building health systems and working with community-based physicians, and is bringing Burke's inpatient and outpatient rehabilitation services to the next level. And I'm very happy to have him here. Jeff, like Milton, and I think like all of our panelists, you've seen radical change in the healthcare delivery system in the last, let's say, 10 to 15 years, whether it's quality management or different models of financing, accountability, et cetera. Certainly a move to preventative care, population-based medicine, ambulatory care, getting folks out of inpatient beds to ambulatory. Talk a little bit about that transition that you've seen, but more to the point of how is that affecting the workforce? How does that affect the kinds of health professionals that you want to see joining Burke or the Montefiore system?
Okay, thank you. I'm going to start with, if you remember anything today, that one of your own, a Lehman graduate, made it to be a CEO of a hospital, and he's sitting on the end here. So you may not remember everything that I say, but just remember that I graduated from Lehman, as you hope to do, already have done. So healthcare is in extreme transition yet again. Montefiore and Burke Rehabilitation Hospital is part of Montefiore, and I'm still a senior vice president of Montefiore. I did all of the expansion, but Montefiore Medical Center is at the heart of what we call the Affordability Care Act, where there's a focus on managing the entire health care for a population of people. Montefiore Medical Center in the Bronx is 85% government payer, one of the highest in the country. And obviously, the need to manage the healthcare needs of that population is paramount. But when I grew up, going back, Bill, to what you said, in healthcare, we were all focused on bringing patients to the emergency department and getting patients into a bed. Well, what changed in the focus of what we called Obamacare and what Montefiore did was doing the right thing for the patient. Keep the patient out of the hospital, build primary care programs wherever possible, interdisperse primary care with behavioral health. Mostly patients who come back numerous times to our emergency departments are patients who have behavioral health as well as medical issues. But the most important thing that I've learned over the years, when we used to discharge a patient from the hospital, we were done. The difference today is we have to take responsibility for the full continuum of care. So obviously the first thing is wellness and prevention. Keep the patient out of the hospital. If the patient has to come into the hospital, you want to manage the care so that when the patient gets discharged, there's a plan of care that you're still responsible for. You're responsible for every aspect of that patient. So when a patient leaves Montefiore now, that patient, if that patient, by example, had a stroke, that patient could wind up at Burke Rehabilitation Hospital, which is an acute rehabilitation hospital. We have a length of stay of about 18 and a half days, but we take care of stroke patients, traumatic brain injury patients, spinal cord injury, as well as a whole host of neurological movement disorder patients, medically complex patients, and cardiac patients who've had basically a cardiac event, a heart attack, or cardiothoracic surgery. From Burke, we're still responsible for the care. The patient could go home, or the patient could move to a subacute or a nursing home situation, or to a home care component of the Montefiore health system. So Montefiore takes responsibility for the full continuum of care. I'm sure we'll get into discussion about what is now potentially Trump Care and how the bridges that we built under the Affordability Care Act for a health system like Montefiore could be very threatened by what's going on now in Washington.
I'd like to direct this question to Dr. Holden. In light of the 62 out of 62 here in this borough and your many years of experience at Montefiore Emergency Room and your program, I'm looking for the interconnectedness or the intersectionality of that and increasing the number of people from racial and ethnic or what they call underrepresented minorities in medicine and healthcare. And the question is, do you think that increasing that number could or will have an impact on the outcomes in our borough, like decreasing or eliminating disparities?
Absolutely. So first of all, we've been able to, I don't want to say attack, but really address that problem in a few different ways. The first way is that we go to schools in the Bronx and we teach children a curriculum that we developed with the National Library of Medicine, and that curriculum not only goes through health science in general, anatomy, physiology, pathology, and biomedical careers, but also emerging topics. Our students learn about biomedical research. They learn about health informatics. They learn about personalized medicine. So this gives them the opportunity in middle school and high school to get that exposure. They are all representative of different backgrounds, many of them first generation high school students, many of them immigrants, and so they are really the window, I think, to helping the community. They're responsible, we teach them responsibility for their community, trying to empower them through projects. So for example, they may take a topic that is of concern to them. For example, one young lady did a project on fibroids because fibroids ran in her family. So she created a great brochure in 9th grade, and she, along with one of our preceptors and OBGYN doctor, actually put those brochures in beauty parlors in her neighborhood. So that was another way for people to get information, females, about fibroids and the latest in fibroid care, and also references of where to go in the neighborhood. So there are projects like this that are being initiated in middle school with us so that students are able to take that information. The other thing we're doing is we're bringing students like yourselves into the emergency department at Montefiore. So you're actually seeing where the minds meet. You're seeing all different types of specialties, all different types of health careers, and we are primarily, I would say, a forerunner in that we have 24-hour social work. So we do address the issues that patients have. So they may come in with a bodily complaint, but it may be that they're getting abused at home. Okay, or they may have other issues at home. So we have to decipher that, but a lot of times it's very busy, so we bring the social worker in. We also have a patient navigator. So a patient may come into the emergency department with a problem that can be helped if they get an appointment at the cardiologist in a day or so, and they don't have to be admitted to the hospital. So these are types of healthcare practices that students like yourselves are being introduced to sooner, so that you're able to utilize those practices and hopefully replicate them once you are a health professional and you go to your destinations.
Question?
You alluded to this, Jeff. Milton and Jeff, talk about, and if you don't have specific numbers, that's fine, but talk about Medicaid. And what do you see as the future of Medicaid? Because obviously there are some proposed changes there, and what kind of impact would that have on your respective hospitals?
Well, New York State now has 6 million people on Medicaid. The myth about Medicaid is that the perception that Medicaid only treats the poor. The truth of the matter is that Medicaid, over 70% of the Medicaid population is the elderly and chronically ill. That's a myth that needs to go away. But the most important thing is that the expansion of Medicaid from a healthcare perspective has given people in New York State access to healthcare, where before they had no choice but to go to the emergency department, the most expensive place to deliver healthcare. And healthcare there was very disjointed. You went in there for episodic treatment of care. You weren't assigned a primary care physician. We either helped you or we didn't help you, and then you were left to go back on your own. There was no continuity of care. So right now, I think the focus is with the potential in Washington under what just passed the House of Representatives. Essentially, states will have the option to opt out of Medicaid expansion. When you opt out of Medicaid expansion, you're basically taking away access to patients who need access to care. And the only place they'll come back to again is the most expensive place for care, which is the emergency department.
So, Jeff, you said 85% is of revenues for Montefiore is government.
Correct. That's correct.
So, folks tend to think about that there are only 11 public hospitals in New York City. There are actually a lot more than 11 public hospitals, and when you look at how hospitals get paid. So the impact of what they're talking about of doing to Medicaid. And just a quick primer, the way the Medicaid dollars flow to New York State, it's 50% of federal government, 25% state government, 25% New York City. And then with the Medicaid expansion, it was 90% federal government, 10% local, right? So even before the expansion, the federal government was paying 50% of 50 cents on the dollar, and New York City and New York State were paying 50 cents on the dollar, then it went to 90 cents and 10 cents. So what's on the table right now in our nation's capital is block granting Medicaid, which is you kind of put a cap on it, and if the number of people in a state that are receiving Medicaid go up, there's actually fewer dollars per person. And so there's going to be less money per capita to spend in any given state. I think the challenge for New York State is going to be, and for the governor is going to be, regardless of what they do in Washington, what kind of state do we want to be, right? And because the city is picking up 25% of those dollars, what kind of city do we want to be? And so the governor and the mayor are going to have to make some decisions as to how to make up, if the state and the city can actually make up that funding. The expansion of Medicaid has been a fantastic thing for the public hospitals. It's been a fantastic thing for the quality of life in the city. Do you simply say the dollars are cut? We don't, that goes away. Healthcare will still need to be provided. Folks are then still going to come to the emergency room at Lincoln to provide that care. We take great pride in being able to offer primary care access and specialty access to anybody regardless of ability to pay. More of those folks will not have insurance, but we still need to provide that care. So it's really going to be a challenge if, in fact, these changes go through at the federal level. What does the state and city government do? Because expansion of Medicaid has been such a good thing for the quality of life of so many people.
Viviana, what do you see as some of the challenges in light of all this dynamic changes going on in Washington, D.C., and the uncertainty of what kinds of dollars will be available, not just from the feds, but from our state government? What challenges do you see in keeping up the kind of program you have at 1199?
Yeah. So one of the good news that you all students in the audience, it's a good news is that healthcare is the only industry that continued to recruit people during the recession. So there are jobs in the industry, and that's good for you to know. Number two, regarding the question, the Affordable Care Act, it's not only about the expansion of Medicaid, and it's not only about providing insurance to uninsured population. It also has, and you addressed a little bit about it, a reduction of avoidable hospitalizations in transforming the healthcare system from the acute healthcare setting, the hospital, and just deterring the patients to outpatient clinics, home care, and long-term care facilities. So we are going to try to prevent people from getting sick. So that requires new skills in all of the professions and occupations in the healthcare industry. So Nunez was saying we need people that is compassionate and that have critical thinking. And he also said bilingual. So yes, so if we are trying to prevent a patient to go with an ulcer as a result of diabetes into the ER, we are going to need healthcare professionals that can address the epidemic of obesity. And if our registered dietitians do not understand the diet of the Latino community and the populations of color, and they just prescribe a diet that it has been taught and designed for white populations, we are not going to address the issue of obesity. Therefore, we're not going to address the issue of diabetes and hypertension, and then we're not going to address the issue of the critical situation that a patient gets into the ER. So we need to avoid for patients to get into the ER, but we need healthcare workers that know the community, that speak the language of the community, that want to help their community. So the programs of study in higher education institutions have to catch up. So if we are going to reduce the size of the hospital in 25%, where are those jobs going to go? So if we are going to make the kitchen, the dietary services smaller, what are we going to do with the incumbent healthcare workforce that in the case of the Bronx, those workers know the language of the community and speak a second language, and they can provide healthcare services. So we need to develop and retrain the workforce so they can help us to address the issues of health disparities in what you were talking about. So, yeah.
I'll pick up on that. In the Speech, Language, and Hearing Sciences Department of Lehman, they've just developed a certificate program in bilingual speech pathology. And we're trying to turn it into a formal bachelor's program. I mean, Dr. Georges will definitely know more than I do on this one, but I will say this. We're knocking ourselves out trying to develop programs that are bilingual. And the reality is we're also resource constrained. And even in terms of things like new faculty hires and or finding faculty with the kinds of skill sets that will allow us to have those kinds of bilingual programs. From my standpoint, having several really top-notch bilingual programs in nursing, in social work, and speech, it's like we ought to be the front runners on those things, you know, because there's no question that there's enormous demand. We did one little pilot in a public school about 2 blocks from Lehman where we were doing healthy weight, healthy food, healthy eating with the elementary school students and their parents. 80% of the parents, their only language was Spanish. So we had to have interpreters, you know, with our frontline people that didn't speak Spanish. So we're aware. I just want to say from my point of view, we are completely aware of the need.
Yeah.
We're doing what we can. And we need to do more.
Yeah.
I mean, honestly.
So the healthcare industry has addressed the issue of language competency with medical interpreters. That doesn't necessarily work because I don't want an interpreter in my session with my shrink. I need to be able to speak in Spanish. You're a psychologist. You know, you go back to your, so how are we going, so the issue here is not only that we need bilingual programs, is that we need more Latinos and minorities in college, in healthcare allied programs of study. We have to start being selective and understanding that the outcomes of the healthcare and the services are going to depend a lot on the diversity of the workforce.
Let me just pick up on this point. So if I were to hire all of the medical interpreters that Lincoln actually needs, I'd probably hire another 30 people. But the truth is I can't afford to hire another 30 medical interpreters. I can't afford to hire bilingual nurses or bilingual PAs or bilingual NPs.
Yeah, we'll send them all to you.
Okay.
I want to pick up also, if I may, on the point about workforce and just give you an example, reinforcing some of the things that I said. So Montefiore, we're big. We have 11 hospitals. We cover 3 million people right now. But directly, we're responsible for the care of just about 500,000 people, meaning that we take in the insurance premium on those individuals, and we basically pay for the care for whether you have a cold or whether you have a heart transplant. But the point I want to make right now, in Yonkers, Montefiore has 1,500 people who day in and day out are focused on the care of those 450,000 individuals. Now, I want to give you an example. It's just an example of an elderly patient who left one of our hospitals with a diagnosis of, let's say, congestive heart failure, meaning the top and bottom part of the hearts aren't talking well to one another. And the most important thing that you can do for that patient would essentially be to take their weight almost daily. And we have people who focus on that type of patient. It's not a doctor, it's not a nurse, it's taking the weight electronically of a patient. And we have rule sets. If there's more of a five-pound difference in a patient's weight over a specific period of time, we will dispatch somebody to that patient's home. It could be a nurse, it could be a dietitian, because we may find out that a patient is not eating properly, or it could be somebody in customer relations, because there may be a family situation, or a social worker. The last thing we want to do is see that patient wind up back in the hospital. What more typically happens without the support structure that I just said is that that patient would call a loved one, a spouse, a son, a daughter, and say, I'm having difficulty breathing. And they would say, ooh, we better call an ambulance. The ambulance is going to take you to the emergency department, and you're going to get admitted to the hospital for about 3 days. Your medications are going to be adjusted. So the difference is $10,000 to $12,000 to admit a patient versus a couple of $100s for monitoring the patient. And that's kind of the difference in where healthcare has evolved to. But the people that are needed to maintain the patient on an ambulatory basis, it's not, yes, we have physicians available, but we don't queue immediately to the physician. And an important point, up in that same location in Yonkers and in Tarrytown, we have 400 people that are involved and focused on customer relations and the patient experience, whether it's making appointments for a patient or navigating them through a difficult component of healthcare. That's how healthcare has evolved. It's not necessarily always at the top of the food chain with the doctor or the nurse. And we haven't talked about it all. What I do for a living, or what you do for a living, is healthcare administration, which is basically running and managing the business of healthcare. I have an MBA in healthcare administration. After I graduated from Lehman, I basically, when I was here, I started working summers in a hospital in Mount Sinai in New York, and that's how I got involved in healthcare administration. And I have an MBA from the Baruch College program, so my whole education was through City University of New York. But the point that I want to make is I think there's another avenue in healthcare for those who want to address the business aspects of running healthcare.
I want to really thank you all for coming. I very much hope you enjoyed the day. And don't hesitate to come by and say hi to me if you want to build some kind of bridge to Lehman. I'm going to hang out for a little bit now. I want to really thank our panelists very much for taking time out of their busy day, and my colleague, Dr. Georges. So take care. Thanks so much.
Thank you.
Thanks.